So one of the reasons it's important to develop essential skills in skin cancer is you have to understand then what are the alternatives for the patient if you can't manage that particular or diagnose that condition. So ultimately, if you can't deal with it, it's then got to be sent on to specialised care. So specialist care could obviously be dermatologist, surgeon, which obviously is expensive and can be very expensive and also very, have to wait a long time. Or it's going into the public hospital system, which typically, as I said, could be, up to a year long waiting list. So the benefits of you being able to develop some skills, which again, so you can at least diagnose, and that's obviously to do skin check, dermoscopy and or biopsy. Even if you stop at that point, we get a definitive diagnosis so we know exactly where to send that patient anyway. And you need to just remember, once again, for most patients, specialist care, there is a very long waiting time. And you don't want to be sending a patient with something suspicious that turns out to be a melanoma that's sitting on a 6-month waiting list. So one of the reasons it's important to develop essential skills in skin cancer medicine is you have to understand what's the alternatives for you and or your patient. So if you're unable to diagnose the cancer, then you have to then refer them out, right? So you're not sure what it is, you know what you're going to do. So you're going to have to refer them. So typically that means refer to a dermatologist, which the waiting list could be 6 to 12 months, so you may not even have access to a dermatologist depending on where you are. And the treatment from there, typically surgical, will be sent on then to surgeons, which once again, there's a long waiting list and it's very, very expensive. And it may not even be necessary, right? Because obviously it may not even turn out to be a cancer in that situation. If they can't afford to do it or can't afford specialist care, then the other alternative is the public hospital system, which is overloaded and could be a year before they get seen. So do you really want to send a patient that's got potentially something that's going to kill them, having to wait a year before someone else gets to see them? So the advantage by you just having these basic skills, even if it's just in dermoscopy and being able to do a biopsy, is you get a definitive diagnosis. So at least then we know exactly what it is. So firstly is there'll be plenty of things that don't need to be sent on. So you're going to save the patient and the health system a lot of time and effort by actually getting to that initial diagnosis. If it does turn out that it's something nasty, you now know where to send it and who to send it to. And if it is a melanoma, you'd be able then to send it on to the appropriate people and get them in very, very quickly. So even just the basic skills of dermoscopy and being able to do a biopsy, but also once again to do some basic treatment is something which you're able to do as well. So these are all very, very simple skills to develop. You might want to do the complex surgical stuff, that's fine. But once again, as you've got that diagnosis, you're able to help that patient and give them immediate care. Because the risk is also you refer them out, they don't turn up. And it could be something which once again then later goes and kills them. And how would you feel if that was a situation? So these are essential skills that will help you in your practice every day.